Come in.
Hi, my name is Grace Duran. I'm going to be the PA student that's working with you today.
Okay.
Before we get started, can I just confirm your name and date of birth, please?
Sure, it's Ilana Florakos, 52593.
Okay, perfect. And if it's alright with you, do you mind if I perform a brief physical exam?
That's fine.
Okay, I'm going to start by taking your vitals.
Okay.
And I'm going to take your temperature. And have you been feeling sick or had run a fever in the past 14 days?
Nope.
Okay, no cough or anything?
Mm-mm.
Alright. I'm going to start by having you lift your tongue. And I'm just going to insert this underneath and completely close your tongue on top. And when the second beep stops, I will be done. Okay? And your temperature is 98.2, which is normal degrees Fahrenheit, and I took that orally. And so next I'm going to take her pulse and respirations. Okay, so I'm going to take your radial pulse. I'm going to have you take that off. Okay, and I'm going to look at the clock over there. I was gonna look at the clock. And okay. Okay, so her pulse was a normal rate of 66, normal rhythm, and a strength of 2+. And her respirations, she had normal rhythm, effort, and pattern, and her rate was 16 breaths per minute, which is all normal. And next I'm going to take her blood pressure. Okay, and so when I take your blood pressure, I'm going to have you rest your feet flat on the floor, have your back sit up straight, your back against the edge of the chair, and do you have an arm that you prefer?
We'll do this one.
Okay. And I'm just going to line this up with your brachial artery. Oh, so to start, I'm going to line this up. Okay, that's the right size. I forgot my stethoscope. Alright. Okay, so I'm just going to start by, I'm going to hold your arm at the level of my heart, and I'm going to start by, I'm just going to pump, you're going to feel this inflate until your pulse goes away, okay? Okay, and now I'd wait about 5 minutes or so to let her pressure normalize. And so 5 minutes have passed, and now I'm going to take your blood pressure. Okay. You're just going to feel the cuff inflate again, okay? Okay, you had a normal blood pressure of 108/72, which is a normal healthy blood pressure. Perfect. Okay. And so the next part of our physical exam, we're going to do the HEENT, which is head, eyes, ears, nose, throat. And we're going to start with the eye exam. Okay. Alrighty. So, sorry, before we get to an eye exam, I'm going to just assess her general appearance. And so, do you mind just confirming your name and where we are right now?
Name is Ilana, and we are in your clinic.
Okay, and do you know what date today is?
August 26th, I believe.
Okay, so the patient appears to be alert and oriented to person, place, and time. And she appears to be her stated age, well dressed, comfortably sitting, no apparent signs of distress, appears to be in a healthy state. She has had normal gait, normal speech pattern, and she appears to have a normal affect. And so then now I'm going to move on to the eye exam, and I'm going to start by doing a field confrontation test. So I'm going to do this on each side, and I'm going to have you cover one eye, okay? And then you're going to see my fingers wiggling and entering your field of vision from multiple different directions. And once you see my fingers enter your field of vision, can you just let me know? Okay.
Do I look straight?
You're just going to look straight ahead,
Okay.
yes.
No.
Okay.
No. 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 No.
Okay, and I'm going to have you do the other eye.
No.
Okay.
No. 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 No.
Okay, and now I'm going to do a direct and consensual, all those results are normal, a direct and consensual pupillary response. So I'm just going to have you look straight ahead, and I'm going to be shining this light into your eye, okay?
Okay.
Okay, and her pupils were equal and round and reactive to light and accommodation. And so last I'm going to do a test your extraocular movements, and I'm going to just move my fingers in an H pattern. I'm going to have you follow my fingers the entire time with your eyeballs.
Okay.
But keep your head straight looking forward, all right?
Okay.
Okay, and everything looked normal there. So next, we're going to move on to the ear exam. And I'm going to start by, I'm just going to have you pull your hair back, and I'm just going to inspect the outsides of your ears.
Okay.
Okay, so both ears bilaterally, there appears to be no signs of drainage, no lesions, ecchymosis, no apparent foreign bodies present. And now I'm going to do the ear exam. And I'm going to look at your tympanic membrane. Okay, and I'm going to grab a cover for this. I'm going to have these ready.
No worries.
Okay. So you're just going to feel me slightly pulling back on your ear.
Okay.
And I'm just going to take a quick look inside, okay?
Okay.
All right. And now I'm going to come over and do the other side. Okay, perfect. And her tympanic membranes were intact with no signs of perforation, and she had no drainage, foreign bodies present. Her tympanic membranes were a pearly gray, and I was able to locate the light reflect. So next we're going to do a nose exam. So I'm just going to inspect from the outside, and her nose appears to be symmetrical with a midline septum, and she appears to have no lesions, drainage, ecchymosis. Everything appears to be normal. And now I'm just going to have you tilt your head up a little bit, and I'm going to just look into her nasal septum and observe the mucosa. Okay. All right, and on the other side. Okay, perfect. And her nasal mucosa was pink, no nasal polyps present, no foreign bodies, no drainage, no perforation of the nasal septum. Everything looked good. Okay, and eyes, ears, nose, throat. And now we're gonna go on to a throat exam. So I am going to just have you open up your mouth for me. And I'm just gonna look into the back of your throat and have you put your tongue to the bottom of your mouth. Okay. And so there appears to be no lesions, moist, oral cavity, dentition is good. And so now I'm just going to test a few cranial nerves.
Okay.
And I'm going to have you, so to test cranial nerve 9, I would be eliciting her gag reflex, which we're not going to do for this video. For cranial nerve 10, I'm going to have you look at me and open your mouth up, have the tongue at the bottom of your mouth, and say, ah. Okay, and I was able to observe symmetrical elevation of the soft palate. And lastly, I'm going to have you stick out your tongue straight for me. Perfect. And she had midline protrusion of the tongue, and that was testing cranial nerve 12. Okay, and so that, and next we're going to move on to the neck region. Okay, and so I'm just going to observe her trachea appears to be midline. And now I'm just going to come around from behind, and you're going to feel my hands around on the front of your neck, okay? I'm going to be observing or feeling for your thyroid, okay? Is there any tenderness? Okay, I'm going to have you swallow for me, please. Okay, can you do that one more time? Okay, and her thyroid was soft in nature. It was butterfly shaped. It appeared she had symmetrical elevation. It was symmetrical in shape. She had no tenderness or no nodules present. And on the neck, next I'm going to listen for carotid bruits. And so for this, I'm going to place my stethoscope on each side. And when you feel my stethoscope on your neck, I'm going to have you hold your breath for me, okay?
Okay.
Okay. I'm going to have you hold your breath for me, please. Okay. Now on the other side, hold your breath for me, please. Okay, perfect. And I did not hear any bruise for that. Alrighty. Okay, and now I'm going to palpate for your lymph nodes. So I'm going to do, you're just going to feel me from behind. I'm going to be feeling different areas on your face and neck, okay? So I'm going to palpate for the preauricular lymph nodes, the posterior postauricular lymph nodes, the occipital lymph nodes, the tonsillar lymph nodes, the submental lymph nodes, or submandibular lymph nodes, submental lymph nodes, the superficial cervical lymph nodes, okay, the posterior cervical lymph nodes. I'm going to have you move one side of your shirt for me, please. Okay. The supraclavicular lymph nodes. I'm going to have you do the other side. And the left-sided supraclavicular lymph nodes. And was there any tenderness in any of those areas?
No.
Okay, so there was no tenderness, no lymph nodes palpable. Okay, so next I'm going to do peripheral vascular and musculoskeletal exam. I'm just going to have you stand up for me, please. And I'm just going to do a general inspection of her upper extremity. And she appears to do, I'm doing an integrative derm exam so far, and she appears to have no lesions, edema. Her skin appears to be warm to the touch, and there's no signs of ecchymosis. And so now I'm going to test for flexion and extension of your shoulders. So I'm going to have you abduct your shoulders to 90 degrees. Perfect. Now push up for me. Okay, good. Now push down against my hand. Good. And now I'm going flex your elbows to 90 degrees. Okay. And now push up for me. Good. Now push down against my hand. Good. And now I'm going to test your wrist. Push up for me. I'm going to have you resist against my hand. Push up for me. Good. And then down. Good. Normal flexion extension of the shoulders, elbows, and wrists. And so now I'm going to just have you sit back down for me, please. And I'm going to assess for her radial pulses bilaterally. Okay. And her pulses appear to be symmetric and 2+ bilaterally. And I'm gonna check for capillary refill. Okay, and I'm just gonna have you turn your hand over. Okay, she has normal capillary refill on this hand. Turn your hand over. She has normal capillary refill on that hand. And so now I'm going to move to the lower extremity. And if you don't mind, I'm just gonna have you fold your pant legs up for just a little bit. Okay, and she appears to also have no lesions, edema, ecchymosis. She's warm to the touch bilaterally. And I'm now going to test flexion and extension of the hips, knees, and ankles. Okay, so I'm gonna have you press up against my hands with your hips, okay? Now down against my hands, okay? Good job. And I'm gonna have you push out against my leg or my hands, okay? And now back against my hands, good job. And then I'm gonna have you push down against my hand, good. Now up against my hand, okay? On the other side, up against my hand, down against my hand, good. Okay, she had normal flexion and extension of the hips, knees, and ankles bilaterally. And now I'm going to test for her posterior tibial and dorsalis pedis pulses bilaterally. Okay. Her posterior tibial pulses appear to be symmetric and 2+ bilaterally, and her dorsalis pedis pulses appear to be 2+ and symmetric bilaterally. Okay. So next I'm going to, are you wearing a sports bra?
I am.
Are you comfortable if I have you take off your shirt for me?
Sure.
So that I can listen to your heart and lungs?
Sure.
Okay. We're gonna have you do that next. Okay, so I'm gonna start by listening to your heart sounds. And I'm just gonna, every time you feel me place this on your chest, I'm just gonna have you hold your breath for me, okay? All right, take a deep breath, or hold your breath for me, please. Okay, I'm gonna be listening to, this is her aortic space on the second intercostal space. Now I'm listening to the first pulmonic in the second intercostal space. Okay, and now I'm gonna have you just pull your sports down for me, bra down for me a little bit. Okay. And this is the second pulmonic or Erb's point. Okay. And now I'm gonna have you pull your sports bra up for me. Okay, and this is the tricuspid position. Listen to the tricuspid valve. Okay. Okay, and so I was listening to that with my diaphragm, and I'm gonna go back up and listen to that with my bell, okay? I'm gonna do the same positions, starting with so I'm gonna start with mitral, with my bell, okay, and I'm gonna do tricuspid, a little bit higher for me, in the fourth intercostal space, okay, Erb's point, okay, first pulmonic, and aortic. Okay, she had normal rate and rhythm, no murmurs, gallops, or rubs, normal S1 and S2. And so now I'm going to have you turn on the side of the chair for me. I'm going to listen to your breath sounds. Okay, I'm going to start by listening to her apex. I'm going to listen to her breath sounds in a ladder pattern. So I'm going to start. Okay. Oh, I'm gonna start over. And each time you feel like press this, I'm gonna have you take a deep breath in and a deep breath out, okay? Okay, deep breath in. Okay. Deep breath in. it okay with you if I just pull your sports bra up a little bit?
Go for it.
Okay. Okay. Were you able to get all the way over? Okay. Alrighty. So she had normal breast sounds bilaterally. No wheezes, ralls, or bronchi. She had a normal rate and rhythm to her respirations as well. Okay, so next I'm gonna move on to an abdominal exam. So if it's all right with you, I'm gonna keep your shirt off for the time being. I'm gonna have you go lay over on the couch. Okay. And do you mind sliding your pants just to below your hip bones? Okay, and then your bra's good actually, sorry. Okay, so I'm gonna start by listening for your bowel sounds. Okay. Okay, she had normal bowel sounds in all four quadrants. So now I'm going to listen for abdominal and renal bruits, and I'm going to listen to these with the bell of my stethoscope. Okay, I'm going to start by listening for an abdominal bruit. And I do not hear an abdominal bruit present. And next I'm going to listen for a renal bruit. So I'm just going to go from the rib to the umbilicus. And no renal bruits are present. And next I'm just going to do light and deep palpation of her abdomen. And are there any areas of tenderness?
Nope.
Okay. So I'm going to start with light palpation, and you're just going to feel my one hand lightly palpating, and then I'm going to go to deep palpation, okay?
Okay.
Any tenderness?
Mm-mm.
Okay, and now you're going to feel me just putting a little bit more pressure. Okay, any tenderness?
Mm-mm.
Any tenderness?
No.
Any tenderness? Okay, and that's it for the abdominal exam. And if you'd like, you can put your shirt back on.
Okay.
And we're going to finish with the neuro exam.
Great.
When's the last time you had a physical?
A while, actually.
Really?
Yeah.
I say there are people who've been doing telehealth these days.
Exactly, can't do that via Zoom.
I know. Okay, so I'm gonna start off by checking your reflexes for this. So I'm gonna do your biceps reflex first, and I'm just gonna have you rest your arm as much as possible, and I'm gonna have you flex first, so I can locate your biceps tendon. Okay, now relax, and I'm gonna have you close your eyes and just think happy thoughts. Okay. And on the other side, you're gonna feel me. I'm gonna have you flex. Flex so I can locate your tendon. Good. Now relax. Keep your eyes closed. Okay. Okay. And she has a normal biceps reflex on both sides. And now I'm gonna do your patellar reflex.
Do you want this?
Yes. So I'm gonna have you stick the pillow under your leg, so your foot's dangling. Okay. A good reflex. Okay, I'm going to do the other side. Okay. Okay, and she has normal patellar reflex bilaterally. Okay. And so for cranial nerves, I have done the reflex. I'm missing something. Oh, come back in 2 minutes, Maggie. Okay, so next I'm going to,
You're good.
I'm gonna observe your gait.
Okay.
I know I'm missing a step in there, but we'll come back to that. So I'm gonna just have you walk towards the camera normally. And now I'm gonna have you tandem walk back towards me.
What's that?
Just heel to toe.
Okay.
Okay, perfect. So she has a normal gait, and I'm gonna have you sit back down for me, please. And I'm going to test for your cranial nerves.
Okay.
So I'm gonna start with cranial nerve 5. And I'm just gonna be testing light touch. So you're gonna feel this cotton ball on 3 different areas of your face. And when you feel it, I'm gonna have you tell me if it's either on your forehead, your cheek, or your chin, and then raise your hand on the side that you feel the touch, okay? I'm gonna have you close your eyes as well, please.
Forehead.
Okay?
Cheek. Chin. Forehead. Chin. Cheek.
Okay, and that was testing cranial nerve 5. And now I'm going to test cranial nerve 7, and I'm gonna have you raise your eyebrows for me. Eyebrows for me, please. Okay, I'm gonna have you smile, frown, puff, frown, puff out your. You're just a happy person. Grimace, puff out your cheeks, and I'm gonna have you have your eyelids open. I'm gonna have you try to close them against my resistance. Good job. And that was testing cranial nerve 7. Now I'm gonna test cranial nerve 8, and I'm gonna have you close your eyes, and you're just gonna feel my fingers rubbing, just a couple on either side of your ear, and I'm gonna have you raise your hand on the side that you hear my fingers, okay?
Okay.
Okay, good. And that was all normal. And now I'm going to test cranial nerve 11, and I'm going to have you shrug your shoulders against my hand. Good job. And now I'm going to have you turn your cheek against my hand. Okay, and I'm going to have you turn your cheek against my other hand. Good job. And we are not doing the genitourinary unit for this, but that would normally be done in a physical exam. And I'm thinking of one more thing for cranial nerves. I did the reflexes and I did. I'm gonna do 2 reflexes. Okay. Oh, okay. I'm gonna have you stand up again. I don't need my hammer. I'm gonna have you. You're gonna observe my finger, and I'm gonna have you originally touch your nose to my finger and back multiple times. And after you do that 3 times, I'm gonna move my finger. Okay? Alrighty. This is called the finger to nose test. Good job. And this is assessing coordination. Okay, good job. And next I'm gonna do the Romberg test. I'm gonna have you put your feet together and have your eyes closed. And I would just close your eyes for me, please. And I would just observe for any swaying. I'd watch for about 20 seconds to see if she loses her balance or there's too much movement with this. And so next I'm gonna do the pronator drift test. These all 3 are assessing coordination. And have you stick your arms out for me, please. Okay, with your palms up. And I would start by just doing this for about 20 seconds time. And then I would observe for any movement or drifting. And then next I'm going to put a little pressure down. Oh, can you close your eyes for this for me, please? I'd observe for 20 seconds if there's any movement. And then I put a little bit of pressure on her arms, and they should bounce back up to the right original position, which they do. So everything was normal. Your entire physical exam appeared normal and healthy, so that is good news. Thank you very much for coming in today.
Thank you.
And I'll see you back in a year for your next
Sounds good.
physical.
Great.
Alrighty, thank you.